The drugs may not stop. But the deaths and diseases could. In 2015 alone, Saskatchewan has had over 160 new HIV cases. Since 2005, 1,458 people have been diagnosed with HIV, 203 have died of the disease, 44 within their first year of diagnosis. The primary cause of HIV in urban areas such as Regina is due to IV drug use. There is an estimate between 1,500 to 2,000 IV drug users in the city and area. Currently, Regina and Saskatchewan as a whole have been lacking in providing strategies to reduce new cases of HIV, with the exception of the needle exchange program. Something must be done. The solution for epidemic levels of HIV in Saskatchewan's capital city, Regina, is a supervised injection site for intravenous drug users. We are modeling our proposed plan of a supervised injection site from the Insight Center in Vancouver. Clients will bring their pre-obtained illicit drugs to the center to inject. The center will provide the clients with a booth to inject their drugs and clean injection tools including syringes, cookers, filters, water, and tourniquets. Our supervised injection site, like the others, will be a part of the continuum for the harm reduction model to reduce health, social, and economic consequences of drug use without forcing abstinence. There will be nurses present to monitor the injection and provide interventions if overdose occurs and treatment for injection wounds or other injection complications. It will work closely with other programs to aid those who want help with their substance use disorders. Our staff will include nurses, counselors, mental health workers, and peer support staff to help provide services and referrals. We are advocating for the supervised injection site to be in 2 locations due to the 2 predominant but separate locations of marginalization and drug use in our city. The main center that will have the majority of the injection booth, staff, and resources will be located in the north central neighborhood as it is the larger area. A secondary center will be located in the core neighborhood of Regina. The difference between Vancouver and Regina is the winter weather, which would discourage users from traveling into a different area of the city to safely inject their drugs. Saskatchewan has an alarmingly high rate of new cases of HIV and of cases of people dying from the HIV/AIDS virus. These cases are often the consequence of intravenous drug use. We are advocating for Regina to open a supervised injection site that will provide intravenous drug users with a safe, sterile, and monitored space to inject their pre-obtained illicit drugs. The supervised injection site will provide benefits not only to the client, but to the public as a whole, with a reduction of the new HIV cases, savings in healthcare, and safer injection practices and syringe disposal behaviors.